Myself, Tricia LeClaire, Chair. Vice Chair Kelly McGovern. Member Vinnie Forty. Bruce Wilson, our health agent, and Tina Griffin, our minutes clerk. So the first thing on our agenda is to review the minutes. Okay, looks good to me. Anybody else done or?
Hang on, I'm slow. Okay, I'd like to make a motion, to accept the minutes for, what was that?
January 12th.
January 12th, as written.
I'll second that.
All those in favor say aye.
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 Opposed, motion carried.
Review tasks.
All right, coronavirus update. Let's hear it, Bruce.
Hey, numbers are slowly dropping, which is good. It looks like the people are starting to realize that we can have big social media parties and everything. Just on the vaccine front there, we finally got our approvals. Long tedious road. I had great help with Esther and Chris from the fire department there, but we finally did get everything in order, and we're authorized now to order vaccine. Hopefully there's some vaccine that can be distributed so we can start to vaccinate our seniors and over 75 people here. Phone continues to ring off the hook. Chris was able to set up a hotline over at the senior center to help people get their appointments over at Gillette and the other facilities. So we're making some progress there. We did place an order for vaccine. Curious to see what they send over. Other than that, it's business as usual. The phone continues to ring. Lots of permits. Lots of complaints. Typical day in the neighborhood. Hopefully the state is able to get their hands on a lot of vaccine. It seems to be a shortage everywhere.
Are the complaints COVID related stuff, or is it?
Yeah,
Usually.
COVID, couple of housing complaints, landlord tenant issues. This one's not wearing a mask. This one's not, the store has too many people in it. The typical.
Oh, the typical stuff, yeah.
Yeah.
Well, let me.
Were we supposed to circle back with the Charles, by the way?
I'm sorry?
Were we supposed to circle back with the Charles on that litigation?
I did speak with Amy over there. The tenant is still there. They're still back and forth on trying to negotiate her departing. It's an ugly situation until the governor finalizes the eviction one way or the other there. I think that's going to be the final straw that it's,
I guess no news is good news on our end then.
oh yeah, no, after the.
Well, it's out of our hands at this point.
Yeah, yeah, I just
We
want to make
already
sure.
made that decision a long time ago.
Yeah,
After town council had sent a letter that put an end to that.
good. Okay. Thank you.
Awesome.
On the vaccine front again, tomorrow I'll be at Franklin High School for the next round of the second doses. It'll be the 10th and then the 17th. A number of you people out there, if you were at the first visit, tomorrow is your second. If you were on the second go round, you're over on the 17th. And I know Vinny will be one of the
17.
on the 17th. So
By the way, just for the little add-on, while Bruce was quarantining and a few other things, so far, nothing to do except during, I think it was Christmas, I had one septic inspection, but other than that, things were quiet on the home front. Anyway,
That's good. All right, so the next thing on our agenda is the cancer concerns that Vinny had put on.
yeah, what happened was, I guess somebody from the state, from epidemiology sent the Board of Health a thing, and then someone complained, well, not complained, wondered what the Board of Health was doing and, if we're actually looking at these documents. The last time I really looked at it, I don't know the frequency of how often it comes to the board. I think it's once a year. But in 16 and 17, I looked at it because of, me looking, at it for a particular reason. My wife had passed away in 16. Ironically, her cancer was ovarian. And then if somebody else wanted to say it was GI, both of those were relatively low on the list of cancers in all the age groups, in Bellingham. What was high was brain and one other cancer. I can't remember what the second one was, but like I said, it wasn't, you couldn't localize it. The people that had the brain, I looked at brain cancer and, I did look at ovarian, but I looked at brain cancer and it was scattered. But through the years, I can tell you right now, when I moved to this town, back in 84, 85, there were 4 or 5 people that lived in this town for many years that passed of brain cancer. So, that was, what, 20, 30 years ago. And it still appears to be in 16, 17, it was our lead. But again, not tied to a specific age group. Certainly the older had a greater percentage maybe, but there were younger people who had gotten it too. And it didn't list the type of brain cancers, but whether they were treatable and the people survived for many years with it, or whether they passed quickly. That said, I don't know what we can say about it. The other person responding, I say, there's one thing we may be able to do, and that would be, we can look to a student who's at, in the medical field, maybe getting a master's in public health, or, not an MD or nursing thing, but there are different students in public health that if they go to Northeastern, their 5th year, they must do a clinical internship with the Board of Health in town. And there was one, Ms. Elliott, back, I don't know, I'll say 10 years ago. She did a year where she attended every meeting, got a copy of the minutes, and we were able to give her a few things. She says, well, can I follow up on these things? We said, sure. You can't really interview people, but you can do searches, and you can, maybe get information that's public and work it around that way there. And she did provide the Board of Health a report. So my suggestion would be is if we can reach out to anybody at the leading universities that's doing a master's in public health or any public health type degree, or especially if they're going Northeastern, they have to do it. And if they're a local person, they would want to do it in their own town. Maybe we can find someone like that and use them as a, an asset for the Board of Health to rely on doing an examination, epidemiological records and disease, it would give us, someone else doing stats on it, and then getting the information from public health, which probably there's more in-depth files than we see. We just see the number of cases, the age group within 5-year increments. So if it's a certain cancer in the 60 to 65, it'll be reported, whether it's a male or female. It'll be reported where their general area they lived.
Vinny, where does that information typically come from?
It comes from
I
the
don't remember ever seeing
Department
it.
of Public Health. Yeah, I know. I haven't seen it in years, but I remember seeing it before.
Yeah, we had it before. I remember before
And
too.
then I went crazy in 16, 17. I really was
It
looking
was before Sue, it was before Sue passed and you had mentioned that, yeah.
Yes, it was during Walter and Cam's time, we had gotten reports, and
It was also during Dee and Louise too, because I was there.
Yeah, okay, but during Walter and Cam's time is when we had a student, a Ms. Elliott. I forget where she lived, but I'm gonna say North Bellingham. And she, like I said, spent a year with us, and that was great. I mean, she did it. She attended every meeting. She gave us reports and she asked for things that she could pursue, and we said, sure, and
Where do you think we could put an announcement to find somebody that could do something like that for us?
I don't know. That's what I'm wondering. Do we try to put that out in Bellingham Bulletin, or it's hard to get the post.
Maybe Dennis would know.
Yeah.
What's the best way to go about that? Finding someone. I think an internship would be great.
Yeah, and I believe too, like if we try, there are a couple of programs that I remember Cheryl Sabraro brought one up to us, that if we try to seek, now that she's the MAHB director, if we try to seek an intern, we can put a grant in to get them paid if they want to do more than just do it for a course. It's an audit for a course, so they shouldn't get paid for doing something that they're supposed to do as part of their coursework. But this would mean we could get someone else who may be more aggressive if we get a grant, and part of the thing would be maybe they write the grant. So year 1, we get them maybe through a university. Year 2 and 3, if they want to do it, as a sort of like a part-time job, we'll apply for a grant. There are state grants. I'd have to call Department of Public Health and say, does the Department of Epidemiology or the Department of Health have any grants available, for students or for members of this town? It's very possible. A retired teacher, a clinician,
Yeah, there's got to be someone that likes to do
might
that
want to do.
stuff.
If we can get a grant, they can get paid. And
I
again,
think we should keep it on our agenda going forward so we can
yeah, it might be a goal thing.
make it one of our goals. Yeah,
Right.
it's a great idea.
And I think if maybe we can have Bruce or we call Laura reach out and see if they're, call the board, Department of Public Health and see if there are any internships and grants for internships for public health issues. Years ago, when the septic loan program started, there were grants. I think 18,000 to get the program started. We were going to hire someone, and then we decided to keep the money within house, and I and one of the other members, mainly me, just kept using DEP to help us put together the program. And then it did result in us eventually spearheading this grant program for septics. So it was good to have a lot of towns supporting it so they could go to the legislature and essentially use a pocket of money that was sitting there as a revolving fund. So anyway, so that I'll end that on cancer concerns, and we'll put that on as a goal. The other thing was an installer I met this week at the bank. I guess he's saying, and while we have Chris here, we can ask him a question, is when you have 2 signatures on a septic loan, if the installer goes to the house and has them sign it, then takes it to the bank, they say, can't do that because they can't witness that person signed that document. It just obviously has to be different than yours, but you could have anybody else sign it for them. and then the release of the money. The only thing I don't like about not having a dual signatures is if someone's complaining about the way someone did something, or that, they didn't do it right, at least during that period of time, when they're closing the project out, usually a week, 2 weeks, 3 weeks, it can't get paid until they make it presentable. Not only our inspections and the engineer's inspection, but that they make the yard presentable as possible, And
Yeah, I would think you still want to have that dual signature on there.
okay.
Yeah,
The question
I
is,
agree.
how do we handle it with the
Definitely.
banks? They have to make, especially with COVID right now, that person has to go down to the bank to sign in front of the, whatever, or in front of the town, wherever the money's being dished out from. So I don't
It's
know.
no different than a construction permanent loan with a mortgage, a builder's building a house. It gets
Yep.
directed to both of them. They both have to sign. Unless we do some sort of like authorization or some sort of notarized form or something that I did, sign this check. I don't know. But
Yeah,
I think
that's another thing too. If you can get, it's tough too. You have to get a notary, not a third person's involved. So Chris, since you're on here, let me ask you a question. Have you
everyone
had
at
a
the
problem?
office now though is a notary, Vinny, just FYI. I mean, Laura.
Oh, that's true,
Bruce,
yeah. So if they come to town hall,
Yeah.
someone, Laura or Michelle or one of the clerks in the treasurer's
The
office
three of
can
us,
sign
I'm
off.
also a notary, Vinny. There are 3 notaries in our office,
Okay,
and then 2 more across the hall.
okay.
And I think
Um,
notary as well.
so I don't know, is that a problem, Chris, when you're in other towns or our town, dual signatures?
It's a problem in your town. We've just recently finished one up on Roy Street, and I had to wait. We put the submittal in for the first payment. I didn't get paid because of the COVID in the offices and everything. The first check was never cut. So I went, 6, 8 weeks. We finished the system because we're into the cold time. We finished it up, submitted all the paperwork, was waiting for the final check. And I was told it was coming to me because in the past it has come to my office.
Okay,
And we're the ones submitting all the paperwork. And I'm waiting. The check's not here. This time the check actually got sent to the customer's house, and they sat on it for 4 days without letting me know. So I went close to 7 weeks without getting paid off a job that I had to finance.
right.
And it was made out to them and me. This is
Right.
the 3rd or 4th time that I've had an issue with it.
Okay,
When you make out at the beginning of this process, we're doing the job. We're a state, we're licensed in the town.
correct.
I can see maybe an affidavit or something at the beginning of the process. If they're going to hire us or any other contractor, something's going to be drawn up. Okay, yep, we're authorizing ADC or whoever, and sign it then. So that when the checks get cut, they get cut directly to us. Because when you're doing it through the town and betterment program, we're not getting our money right away. So we're actually funding everything up front before we get paid. Especially this time of the year with COVID and everything, it's
Right.
taking us forever to get paid.
Well, COVID, there was a reason with the COVID because we weren't able to go in and sign anything. So I think the complaint is more the efficiency in getting the checks cut versus the dual signatures at this case, so isn't it?
Well, the dual signatures are a pain because we had one of our last systems prior to this one. It was a dual signature. The person that we needed to sign that was out of town. They were gone for 2 weeks.
Yeah.
So I had to sit on this check for 2 weeks because I got nobody to sign it. So
Yeah.
here I am waiting for our money. 2 weeks later, they come back from vacation and I was able to get them to sign it. But it is a problem because we're sitting on money that we've already completed the work, and Mr. Wilson already came out and inspected everything. So everything was good.
Right.
Mhm.
So I don't know.
So Chris, what do other towns do?
Believe it or not, there's not many other towns that offer the program. The town of Millville does.
Yeah.
The check gets cut right to us.
Okay. I don't know.
Okay.
I think, irregardless of COVID, I think this is a problem. When someone does get a check signed by the customer, then they take it to, is it coming to our treasurer's office or it goes to a bank? The bank will not release it. They don't know that's that person's signature. So I don't know if that's.
Then we deposit our checks. So that's never been a problem.
Okay.
Once I stamp it with, for example, my company, it's stamped. It's not my
Just say
signature.
for deposit, right? And it just goes right in.
For deposit, and then the other
Okay.
person's signature's there. But I think for future, something, especially in the betterment programs, there should be a form drafted saying, hey, we're authorizing ADC to do this. They're the party that's going to get paid, or any other company that's doing work in town on these programs. And
Okay,
I think if that
And
doc,
maybe do that authorization just before when we sign, we
Correct,
give authorization to sign it, have the authorization then, and then we know to cut it just to them or just to you. I'm
Right.
okay with that part.
and that authorization can also be signed off by the customer once they contract with either ADC or somebody else. Okay,
Well,
let-
not sign it then. You want to have it signed when it's.
no, you
when
want,
each
okay,
Phase is done.
okay, okay, in phases then, okay, we'd have an authorization affidavit.
Yeah.
Okay, where will that follow the application in the betterment process?
Well, it probably should be in the packet, right?
Okay, okay,
At the
So
very
it's-
beginning, and then everything's done at the get-go.
okay, and then the
Absolutely.
checks are cut directly to them.
So Bruce,
Okay.
we'll need to have some sort of authorization to put in
Yeah,
the packet
Put
and then
something
make
together
sure
with
it's
the-
attached.
With that
Okay.
document that we get between the town and the applicant.
Okay, do we want to make a motion to that, or do we want to have town council draft something for us, and then we'll make that motion? How do we want to
I
do that?
think we should have town council draft something up first before we make a motion on this.
Okay,
I don't know if
well,
we need to.
one
make a
other thing
motion.
on this, we were asked, I've had homeowners ask me when I went to go have them sign, they've asked me, why are we signing this? Why is it made out to me? Because they're actually confused at that point,
right,
because they're out of the loop. They know that we're doing everything. So now they're like, why? They're actually getting kind of confused why they're signing something that we already were awarded the job.
you're thinking you might be getting paid twice? No, not really, right? But it could, look like that. Yeah,
Well, they can call the office and talk to Bruce or Laura too about it.
Yeah, but if the agreement's in place, I mean, we've got lots going on. It'd be like streamlined if they knew up front and took care of it.
Yeah.
You know, at
So,
the start.
Bruce, why don't you put together some kind of affidavit that, will
Well,
work?
town council's gonna do that, Minnie. Have town
Yeah,
council
okay.
something
Yeah, but I
more
mean,
formal.
okay. Once you have town council, Bruce, draft that up and then we can do it at the next meeting. We'll make a motion to use the affidavit in lieu of the signature of the homeowner. And Chris is right. There's very few towns left on this 351 towns that were involved with it now. I mean, it's probably a handful. There's not
It
many
is.
towns. That's the reason why they raised the loan rate from 0 town payback to 1%. We made it 2 plus the 1 because there's not enough money going back to keep the funds going, so anyway. That's it.
All right, is that it?
Yeah.
Okay,
Thank you, Chris.
so we're gonna, thanks, Chris.
Thank you. You guys have a great night.
Thank you.
Take care. All right, so the next thing on the agenda is public health nurse job description. So I did look that over and it looked pretty good to me. I don't know if anyone saw anything on there that they thought needed to be added or.
I left this one completely up to you. You're the nurse, so this is all your lingo and verbiage. Anything
I
to do
looked
with,
at it.
finances and stuff, you let me know, but this is you.
I looked at it. It looks really good to me. I think it covers everything.
Thanks, guys. As a civil engineering person, I did struggle with it a little bit, but I thought it came out pretty good too.
Yeah, it did come out good.
I'm starting to put another feather in my cap and becoming more medically oriented.
Yeah.
You really are.
You've gotten way over engineering now. So the other thing too is I looked at this and,
It's driving me crazy.
sorry, and then we have
Can you
the,
hear me?
go ahead.
Okay, no, I didn't know if you could hear me because my speaker keeps going on and off on my phone. My phone's going crazy. So,
Yeah, I can hear you.
um,
So anyway, based on the application, I assume that, not the application, the job description. I assume is Esther seen that, Bruce, or not?
Yes. Yeah,
Okay.
no,
So
I,
that said, she's fine with the way it
she
is.
helped create it, Vinny.
Yeah, okay, great.
She helped them put it together.
Okay, great. I didn't think both was into writing job description, but between Trish, Esther and,
You can do anything.
right, and Beth, I guess we're all set with that. Anyway, back to the next part of that thing is the memorandum of understanding between the town Board of Health and the public health nurse. Initially, we have to worry about going back to January 1st, and then it says here starts July 1, 2021. Why don't we do it January 1 to July 1, 2021, and then put it on the fiscal year instead of the calendar year after July 1? Because the way it is right now, she's under the old contract, which, did we have one? I don't think we did. So that said,
Oh, no, we did, but it got lost in the shuffle
correct.
somewhere.
We need to
And
amend this, make this a
uh,
6-month contract to get us to the fiscal year. And then we'll go from June 30th or July 1st to the next June 30th or July 1st. And that'll be the contract period and not make it calendar period. Because I think most town contracts run with the fiscal thing. So that way there, when the drawing money's out, we don't have an unfunded Board of Health requirement going to town meeting because we're paying someone out of money that, I don't know, was in a different pot. So I guess we should do that. And then she's agreed to the cost per hour effective from January 1, to July 1. And then in July 1, I'm assuming she may be able to go back to 10 hours, but I don't think COVID's going to be over in July. So we'll do that she'll go back to regular hours when we're out of a pandemic and a emergency situation. Because
I wouldn't shoot for July.
neither would I.
We still have vaccines and stuff that need to be done.
Correct. So I'm thinking, shouldn't we amend this to do a January to July, or do it a January to June 30th, 2022? But you need to cover the period of time where we're going to go back and upgrade her salary, her hourly rate from January till the present time. And then at the present time, should be working on that hourly rate until either June 30th of this year, or we go to next June 30th of 2022. So maybe we just do that, change the period from January 1, 2021 to June 30th, 2022. And the rest of the stuff that's in red, I looked at it. If it's okay with her, it looks okay with me as a Board of Health person. And if she signs it, that's her contract, But right now she'd be signing a contract.
So I'm fine with that going into 2022.
Okay, so we'll go from January 1. That's the only change we have to make. We have to cover this period of time. And we just do it that way. And then we can have accounting figure out what the difference is on the number of hours that we owe her for the rate, the slight rate increase. That's nominal considering all the work she's had to do. And I think any other nurse, even the past one, was charging us a lot more than that. So whatever.
All right, so I'm to change and then get it into a document that Esther can endorse.
All right. So I don't remember seeing the raise in there though. Is it already in there?
It's already in there. It went from
It's already in,
45 to
okay.
50. It's $5 an hour. And we
Okay,
did,
perfect.
we did agree that we would, since we didn't have a contract, we couldn't find it, and we couldn't find a description. We would go back till January 1, not December, but January 1st, and she's okay with that. I mean, it's been, a lot of work for her, and I think she's done
She's
a
done a
good.
fantastic job.
Yep. It
And she's
certainly,
calm and patient and
I'm just going to throw it out there. The past person was doing whatever she wanted. She was not answering to the Board of Health. We're her supervisors. And she was answering to the town of Upton and treating the town of Bellingham as like we didn't exist. And she actually got raises without even asking us. She just went to the town of Upton and they said, okay, we'll give you a raise and then everybody else paid their portion. And, you know, I was terribly unhappy with that. Plus, the former director of the senior center was livid with her after a while. You know, she was just mistreating the seniors, and we're not doing that in this town. Not because I'm a senior citizen, but whatever, just because.
That's not how we roll.
All
No.
I can say is she's a key valued member of our COVID team.
I agree.
Without her support and Chris Milo, my task would have been almost insurmountable. This has been quite a year for everybody. And with her on the team and everybody else that's on our emergency management team, we've done a pretty good job in getting through it.
I couldn't agree anymore.
And it's still uphill from here. We still have to do our EDS once we get our vaccine, and we'll go from there. So that ought to be fun. Whatever.
All right. So the next thing on the agenda is CBD products.
Yep. Can you guys hear me?
Special.
Yes,
And Rob,
Okay, perfect.
Hey, Robbie.
How's it going? I have a quick update for you guys, but not what I was hoping to have for this meeting. Bruce had helped me a little bit with this and was able to work with some of the other towns. So basically going over some of the bans that the state had put in place that we were kind of hesitant on. So in total, we are up to 32 communities, I want to say, that are looking to actually get in on the new permit structure with us. So we have narrowed it down to basically accepting what the state has issued as the approved product list. Bellingham specifically is requiring the card readers, and we're hoping to put all of that into place for July 1st. Bruce and I have been going back and forth with some of the local boards of health, and I have also reached out to Framingham's Metro West Division for their tobacco enforcement, and Waltham and some of the other larger cities that are seemingly on board with this too. So hopefully we'll have a more united front kind of going forth, but I may not have anything until for a few weeks, just to everyone, you know, gets back with what their changes are, or what their additions are.
That's great.
Thank you.
I think it's good for everyone to be involved.
yeah. So Rob, one real quick thing. So some
Yeah.
of the things that we had said that were like on the list that we said we're either put them in a permit. Would we be grandfathering a few people that are even operating with those guidelines that are not allowed, or would we make them allowed under a special permit?
The
Long as-
way that it is being written now, they would not be allowed. We actually received, or I received a call from a couple different boards of health that had implemented the food ban, asking why we were still allowing them to sell those products. One of them was Medway,
Okay.
and I think one of them might have been Blackstone, because they had had complaints from their retailers. So I think part of just being in a
Okay.
united front is
Correct.
doing the same product list.
Yep. We'll do it like tobacco, you know, if it wasn't 21 in the next state, we'd say, well, it's 21 here, and it is what it is. Okay, that's fine.
We keep in mind too, Vinny, we can't be weaker than the state.
No,
So-
I agree with that, and that was brought up last time, and I said, no, we'll have to follow the state guidelines, but at this point, we had no permit, and based on what Cheryl had sent out as what she wanted all the boards of health to adopt as our director and as our town council, our Board of Health Council. She's certainly well versed in this. You know, obviously would never want to say that we're going to do something that violates state law. We're not going to do that.
Right, no.
Um,
So I think that's great.
Okay.
No,
Great.
Take all the
Thanks,
time
Rob.
you need to
I
get
didn't
it
realize
done.
it was up to 32 communities. That's awesome, Rob.
That's a lot.
Excellent work. I know we set a lot of it in motion, and you probably got some support everywhere else now, but
Mhm.
Great job, Robbie.
I think it'll ramp up. And the other thing too is, as Robbie mentioned, Medway and Blackstone are neighboring ones. You certainly can't have, you know, it's, how do I say it? It'd be different if it was Boston and Worcester. You'd say, wow, no one's going to know that Bellingham's allowing it, you know, but whatever. We're not going to do that.
when we first
We will
started
follow
looking,
state law, and as soon as the permit's put together, that's what will be put out there, so.
When we first started looking at it, Vinny, some of the boards of health that we reached out to are in a different region, and you know, it was kind of tricky because some work with Cheryl and some don't.
Right.
I mean, it's gotten viral, I would say, if we got 32. So that's good. It gets some momentum and you know, a lot more support, you know, including
Yeah.
the regions.
Well, I think, you know, the reason why, you know, it probably took a while to look at this because it had been brought up before, the CBD products, is we were still working our way, to keep waiting for the state to pass the 21 law. And, you know, everybody around Bellingham was actually already at 21 by their board. We had to do it before December 31st of last year, whatever it was, because if we didn't, anybody 18 before the ban would be allowed to purchase legally, and every vendor would not be able to figure out, is this person a legal 18 or an illegal 18? In other words, illegal because they're under 21, but they would be grandfathered. It would have just created a, you know, a worm, you know, we call it rat's nest. So we passed that under Cheryl's advisement, and that just made it easier for all our businesses to not have to worry. Now you use your card reader or you use another method. They're not 21. You can't sell them a tobacco product, you know. And then we got rid of vaping because, you know, there's just.
With
Now-
Robbie on here, I was just curious, did we start working on a contract with a job description for him as well? Because he never got one, Bruce.
Yeah, next time, I wanted to take care of that right away. Then when I
Okay,
either, I've got a number of projects that Robbie and I are working on, and that's one's on the list.
okay,
other
all
thing,
right,
too,
so
wasn't the-
maybe the next
Sorry.
meeting, or,
See what we can do. I've kind of
okay,
short month this month. I'm out the last week. I'm gonna take a second stab, or a third or fourth stab, I should say, at trying to get a vacation squeezed in there.
Well, we
I
may
did see that
have,
on the calendar.
we may have it ready for March, if, you know,
Okay,
whatever.
just don't want it to go unforeseen, that's all, so. Just keep, Tina, can you just keep making sure that it's on the agenda?
Yep, will do.
Thank you.
I had a quick question too for Robbie or Bruce.
Yeah.
Save More, are they all up to date on their installments paid up through the end of January was their deadline, right?
So they extended through to June,
Okay.
was one of the things that we had done at one of the
Okay.
previous meetings. So,
I had it in my calendar for January 31, so I obviously didn't update that.
yeah, you're good. They had originally agreed to do January 31, and then when they asked for the reduced payments, we extended through to June for the end of the fiscal year.
Okay,
So as far as I know, they are up to date on their payments, and they have their card reader installed, so they are finally all set on that
Perfect.
front.
Oh, good.
Two things I actually just wanted to bring you to your attention to while we're on the topic. I did get some basically retracted guidance from the state. So the state originally told us that we could combine our fines. So in the event that someone had a state violation and then a local violation, that it would count as the second violation for the local and vice versa. The state has since retracted that because we have separate fine values. I assumed that we didn't want to start enforcing $1,000 fines for some of the local stuff, but it's totally up to you guys. I just wanted to bring that up to your attention. They said we could do some rewording of the regulations that would allow us to have them count as additional offenses, but it would need to be worded a certain way.
I don't think we need to do that. What do you guys think?
Yeah, I think we'll, so in other words, if they have a state violation, it won't count as a, on our tally?
So in essence, they would be allowed 7 violations. They could have 3 state and 3 local.
Okay.
Yeah, but it's usually the local ones anyway, or is it the
Correct.
state
We're
ones
usually
that
catching
they?
on the local. That's fine. I guess.
Yeah,
Fine, yeah.
yeah.
And then one final thing for you. We do have another retailer that, just to put it on your radar, the Family Dollar that's being put in the plaza behind Dairy Queen is looking to get their tobacco permit. I just did the quick, Google Earth check. They are within 500 feet of another retailer. They are within close proximity to both Bellingham Grocery and the Shell station that's right there. So I did not know if that would disqualify them, but they may be coming for a appeal or something of that nature. So I just wanted to.
I had no idea
on
they
the
even
radar.
sold tobacco.
I didn't either until I walked into their opening inspection today.
That's
Okay.
interesting.
Put this way here.
Yeah,
where
I
they-
never seen that either. I don't think, do they do that in other towns or?
They could. Apparently, it might be more common out of the state. The people that were there were not necessarily from this area. I know that one of them was from Virginia and the other one was also out of state. So they were there.
So right
just to
now, are
witness
they
this.
selling without a permit, Robbie?
They are not. They have these shelving units in there to be stocked, but they have not stocked them.
Okay, do we have any idea, like, I want to use the 500-foot rule. How far away are they from, let's say, the Shell or the Bellingham? Is it
They are
400 feet?
they are directly across the street, but depending on where it's measured from, I mean, I'm getting somewhere between 300 to 400 feet.
Okay, yeah. I'd say they'll have to come in for a variance for that, and I know.
Vinny,
Here we
Vinny,
go.
We're not doing variances, Vinny.
Okay.
Vinny, why have rules if all you do is say, okay?
Well, if it's 100 feet, 200 feet, I'd say, no.
We just did that one too, Vinny. We just put that in the,
Yeah.
We did?
the
Okay.
regs
Okay,
not too
never
long
mind.
ago, and it was that and that they can't sell tobacco. How many feet is it, Robbie, from the school? Do you know off the top of your head?
It's 500 feet from a school and 500 feet from another
Oh, really?
retailer.
Right.
I thought it was 1,000 from school, but okay, that's fine. Okay, right, no mind. They can sell everything but tobacco.
I mean, there's plenty of places right in that area, honestly,
There are.
Mhm.
to
Yeah,
get tobacco.
yeah, yeah.
I only bring it up because I know that there was another gentleman I had spoken to that I told him would not qualify. He was actually trying to rent out the spot that Bellingham Grocery was previously in,
Oh,
and he had wanted a permit, but where it was directly behind them, I didn't.
That's where I have a problem with variances, because we were making exceptions for one,
right,
and the other
right,
ones,
right.
you can't do that.
Right.
It's
Okay,
just not
that's
right.
fine.
No,
No,
you have
I-
to stick.
Since that was one of our new part of the regulations, no, we're not gonna vary it. Okay, that's it. By the way, too, the other quick question is, did we have another permit anyway, or not?
We do have additional permits. I think that we have 27 total, if I'm not mistaken.
Okay, I
because there
thought we
was a
had
few
like
that were
29.
retired.
Okay. Okay, so we're
Yeah, I
allowing
thought
up
we
to
were up
30.
there, but then who closed? Someone just
Little
closed.
General.
There was.
Little General.
Is that indefinite closure or just temporary?
No, it's indefinite.
New owner.
Okay. Okay,
So how many permits do we usually allow? Is it 30 is our
30 is
top,
our
or-
max.
30 is our cap.
30, yeah.
Yeah. So
I
we're
thought we
almost
were at
there.
29. We had one, but no mind. I guess we're down to 27. Okay. Okay, so if they move there, unless they can rent a different store a little further away in that plaza, probably not, right?
Not-
Well, that
Plus,
was
I
my
think,
other
did they
question.
still have a down in that plaza? Do they still have a daycare down there? I knew they used to.
I believe that is one of the spaces that has now taken over.
Okay.
Okay.
Yeah, because the daycare, it's 500 feet as well, or is it 1,000?
I think that's,
It's 500.
500,
I'll
okay.
take a ride by, because I did do an inspection earlier this year, so I want to say that they're still there.
Really? Okay.
The daycare?
Yeah.
Okay, that's
Yeah. So then they wouldn't, because I mean, that's considered a school type,
Correct.
right?
put it this way here. In my eyes, those are more sacred than another store, but that's right. No variances because it's 500 feet.
Yeah, it's definitely
and
says,
We'll just leave it the way it is. I agree with you, Kelly.
tobacco product sales permit shall not be issued to any new applicant for a retail location within 500 feet of a public or private elementary or secondary school as measured by a straight line from the nearest point of the property line.
Okay,
So then there's two things that
Yeah. there's
are
two
against
things.
them.
okay.
So,
That was my other question too, was where are we measuring that property line? Because I just did it from the front door of the store to the other business.
Yeah, that's a
But I
straight
was
I think front door is fine. That would probably be like.
Yeah. I would call that the property line from a business because the business doesn't own the parking lot sidewalk. Whereas if it was your house, If they measured from the closest property line, then it's your Bellingham acre. It could be anywhere on that, not the house, but on a business, I think
Vinny,
know, they may own the whole land, but in this case, they're renting a, what do you call it?
you've got a lease line and a property line. The lease line would be the face of the structure.
Correct, right, okay.
Oh, okay, so,
And if it were a property or a property owned, then it would be from the property limits. So it's-
Yeah, so since these are businesses, I would assume it's not the property line, it's the lease line. So you're right, Robbie, from the door, closest point
to the
to
door.
either the other store or in this case, a daycare, which I'm more, not wanting to even think of it. It's near a daycare or a school, whatever. So,
Thanks for explaining that, Bruce. Good to know.
That one's my specialty. I have a license for that one.
yeah, I know.
Yeah, I know. I figured you knew the answer. All right, so what else do we have on this agenda?
Update.
Food inspector updates. Rob, you're back on.
Yeah, so everything so far has been good. Doing mostly the level 1s and 2s right now, just to get them off the schedule. But all the restaurants that I've been communicating with, either due to capacity or a majority of the complaints I know that Bruce has informed me of or that have come in were due to capacity limits. So there was been a couple places I've had to go in and speak with just because they were exceeding the 25%.
That's changed, Robbie. The governor did change it. We're at 40% now.
At 40 now,
Yeah,
right?
so we're at 40 now. Everything has been okay. Nothing like at the beginning of the pandemic where everyone was failing. So no news is good news, I guess.
Thank God. That's good. Well, they're busy, so I guess food's not going to waste anymore.
Right.
Very true.
Starting to back out. All right, so we have February calendar on the list next.
Yep.
Which I thought we already saw this once before.
I think
We
it's
saw
just.
it
I think
last,
you have-
last
you have
meeting.
this vacation.
Yeah, we did have it. It's been modified slightly.
Okay.
Yeah, you're not for 2 weeks now, you're just for a week, right? Is that what the difference is?
I decided to stay in the country and take a chance.
Good.
Kelly said it was nice, so I'm taking her advice.
Right. Well, not to mention, Bruce, if you quarantined because you had to, and that was 10 to whatever days, you don't want to go out of the country or the confines of Massachusetts and have to do another 10 days. Unless it's, you want to have your vacation longer by quarantine version. So what are your dates, Bruce, now again?
I'll be up. I fly on the 20th and return on the 28th.
Okay, so 20th to 28th. Okay, I got you.
You're on standby for the fire department.
Oh, okay. What? Okay.
The gasoline spills and the.
Oh, yeah, I got it. Okay, I got it. Yeah.
fire in
Yeah,
the
we
top-
haven't had too many calls, from police or fire, which is knock on wood.
Yeah, I know, you just jinxed us.
Yeah, well, I don't believe in that.
Bruce, you're getting your second vaccine, right?
That's
Before
Yeah.
you go?
Yep.
Yeah, I'm getting mine the 17th. You're getting what, tomorrow or
Yeah,
17th?
tomorrow.
Tomorrow, okay.
I'll be volunteering most of the day, and then I'll get my second vaccine, and hopefully no kickback.
Yeah. I don't know. I think
Lester had a little trouble with her second one, so
from what I've heard
A lot
on
of
some,
people are having some problems with their second one. Just make
Yeah,
sure
but a
you
lot
take
of
some
people said-
Tylenol or Motrin right after you get it. You'll be
Yeah.
good to go.
a little Tylenol, okay.
yeah, well,
Yeah.
whatever.
I was
So,
thinking tequila, but that's okay.
yeah. So the other thing I've
do
heard
both.
is there's quite a little network of sort of medical people I have a little channel with on Facebook, and a lot have been saying, that they have to take it if it's job related, but some are not. But anyway, we're not going to go there. But some are saying if you didn't have
Hey,
any reaction,
nobody is making that mandatory.
You know, that's what somebody's saying. And I said, well, you know, you're in the hospital. I think you're at risk. Why do you want to take a chance of bringing it home? Or I said to someone, even though you're younger, doesn't mean you can't die. It doesn't mean the people who are dying are all over 60. No, 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 no. There are 35, 40s, and 50s that have died. And, you know, and they didn't even know how they got it, but they ended up dying, you know, police officers, firefighters, school teacher. So, you know, you're not, it all depends on how your immune system is, how, let's say, resistant you are. But if you don't know and your immune system's down, not because you're getting chemo, just because it's down, because maybe, I don't know, you're having a low cycle in your immunity, and all of a sudden, bang, you catch, you know, not the flu, but the COVID virus. That's a lot heftier. In any event, that said, people are saying if they had like just a little soreness or a little nausea or a little fever, that's all they got in a second. But a lot of people are saying if they had no symptoms, like I had zero, except that the day after, 1 inch square around the Band-Aid was sore and it was gone another day. So I took Advil the first day as a pre-strike and then post, and I didn't think I needed to do it at all. It did not have any effect. So I'm going for like, okay, no effect for the second, which the second technically is going to be a little bit stronger, a little bit more mRNA, but we'll see what
So
happens.
you guys are both getting vaccine at the same time, you and Bruce?
No, he's on the 10th.
He's on the 17th.
I'm on the
Oh,
17th.
okay. Well,
Yeah,
that's good, because if you don't feel good, then you got Vinny as a backup.
correct. Yeah.
My backup, go to.
Thanks, Trish.
Vinny, I
Plan ahead.
personally picked out that guy that gave you the vaccine because he was designated the best shot giver in the house. So
Really?
Oh, yeah.
to the
Yeah,
best.
by the way, he gave it to me. I didn't even think I got it. I thought he missed. I said, oh, he must have missed my arm. I didn't even feel it. I mean,
It's actually a tiny needle. It's not that big.
yeah, it's a
Yeah, the needle
25 gauge
does, yeah.
short needle, but the point is, you still have to put it into the muscle, you know. Now, again, I don't have much fat around my arm, so it got right into the muscle in less than a millimeter. And, you know, I didn't even know he did it. He said, oh, you're all set. I said, really? I said,
All
oh,
in the
okay. Of course, I was talking, so that probably was the reason why I didn't notice.
Right,
it.
took your mind off of it. Took
Correct.
his mind off of it too.
Whatever.
All right, so do we need to look at the calendar, or are we all
No, I
set
think
now?
we're good. I got Bruce covered, and we're doing the one meeting or two tonight, this month, rather.
Just
I
one.
think we're just doing one
Okay. So
short month.
short month. Yeah, it is short month too.
So the next meeting would be on March 2nd or March 9th.
I think I
Second,
had,
It's usually on the agenda, but it's not on here.
Yeah. That's why I asked. It's not on here, but
I have it in my calendar, but
Probably March,
haven't-
it's the first Tuesday, right? So March 9th.
yeah.
No.
Oh, no,
March
it's
2nd.
March 2nd.
right.
March
That's
2nd
what
or
I
March
had, March 2nd.
Yeah, we'll do the first Tuesday, just in case,
March
Uh,
2nd.
put it this way here, just in case we need to announce that we're having our EDS, and then we'll do, reverse 911 for the people that we need to target. And we'll need to make sure they register, because they don't register, they go through the line and they get exited right out. We have a good plan. We
I
met
think
with
the first round, Vinny, the state is talking about a small amount of dosage. So we will probably be looking at Rentham Manor, Depot Court, and
Yeah.
Senior Center for the first location. But I mean,
Okay,
it's going to depend on how much they'll give to us. So it could change. or
okay.
come-
Well, I thought we applied for 1,200 and you said 200 to the Rentham and,
But Vinny, don't throw numbers around until they send it out, because
okay, fine.
I did apply for much more, but I don't know if they'll give it to
You
us.
probably won't get it. Okay, that's fine. Okay, well, anyway,
Always go for more.
that's right. You always go for more and you settle for less.
That's what we have the backup
Exactly.
team. Chris and I meet daily, several times a day, actually.
Yeah.
And we've got all different kinds of scenarios worked out.
That's the same thing when you're going in for a raise. You ask for the world and you settle for like I don't know, postage stamp.
I'll keep that
I
in mind.
saw this software engineer, she had developed a program. I don't know if you guys saw that at all.
Yes, I did. That's great.
You have that? and
So
we'll-
I should, I'll probably share that on our Facebook page too, but once you click on the link, it shows all the towns in Massachusetts that are giving COVID vaccines and how many slots are available.
Yeah, go ahead.
and
It's a
who
great
they're giving the
program.
vaccines to at the time. and you
Trish,
can sign
we
up.
set up a hotline through the senior center.
Yep.
Don't have computer access or are not computer savvy can actually call that number, and there are people helping them through that, and we are utilizing that link.
Good.
So we should probably put both on our Facebook page, Bruce. What do you think?
Okay, all right.
Yeah.
If you want to, I don't know if you have the same link as I do. If you want to put the phone number, I can do the link, or I'll text you the link or
Yeah, no,
something.
we have the, I'll put the link if people want to do it directly or work with the phone number. Right now,
Okay.
it's an answer machine. You call, leave your name and number, and then a team member will call you back and set up, help you, walk you through, or actually go online and help you find an appointment.
Okay.
This might
Now,
sound like a silly question, but is Massachusetts only vaccinating Massachusetts and Rhode Island's vaccinating Rhode Island? Is
Correct.
that what they're,
yeah.
okay, that's what I
Yeah.
thought, but
And the other quick thing is, it's been going around on some of the Facebook people that are on my friend page, that initially Framingham, people stayed there 3 hours, and then they said, oh, it's Framingham only. Now they did post it because they were offering it to 75 and over with a, whatever it was, one COVID thing or not. And people showed up. The good news is, because they already had a lot of vaccine, they put all the Framingham residents through the thing first. But in the next, you may have to wait 3 hours, but in the next 3 hours, every person that was there from another town, like there's somebody from Franklin, I know, there was another person from Medway, I know, nobody from Bellingham, but there was 3 or 4 people I know in 2 or 3 towns around us, and they did get service. They just said, Benny, I had to wait 3 or 4 hours, because one of them had called me and said, when's Bellingham doing? I said, I have no idea. And at that point, I didn't even know Bruce had applied. When I was talking to these people, I said, hey, if it's available, go do it. Now
Right.
every site is saying, like Medway site says Medway residents only. Framingham says Framingham only. But the first few days, you went to the state website, you signed up. They told you the closest one. They sent you paperwork there. The problem is, when the health official in Framingham saw it, they said, oh, no. Who said that you could come here? Because they had a big sign in the door. But they didn't turn anybody away because, they had vials, and they just said, we're just going to use them. So
well, that's great.
As the process progresses, they're
Right,
making
right.
changes to the booking software. It's getting easier to use, but it's also getting more restrictive. If it's town only, it's got places when they come
Right.
together so that only town applicants can apply.
when we get ours, let's say we get 1,200, Bruce, and we take care, like you said, the Rentham Manor and the Depot Court. Once everything else is there, we should be having at that point, people, let's say it'll probably be down to 65 and over in 2 weeks.
Yep.
Let's just say right now, if you get your vaccine next week, it's 75 and over. So those people should be able to jump right on, register, and Bellingham would get priority. Certainly, we're not going to take people from Woonsocket, but if it's another mass town and we didn't get 75 and over, do we open it up to lower than 75 in Bellingham, or do we treat anybody who's there that's 75 and over?
You gotta follow the guidelines because the state is cracking down, Vinny.
Right. I definitely have to stay
You
within the
gotta follow
guidelines.
the phasing
Okay.
plan.
Okay, so we would treat everybody 75 and over if they're given our site as a site that has vaccine. Okay, thanks.
All right. So next thing on the agenda is bills. You got the bills, Cal?
I have an update.
Oh, he's got updates.
Oh, he has updates.
I'll take you.
Taking the COVID hat off and putting on the triple E and the norovirus.
Yeah, I did see that, Bruce. Thought that was interesting.
Have received some information from Norfolk County that they will beginning putting together their spray list shortly. So all you people out there, stand by. As soon as we have it, we'll post it and send it out with a code red call. There are a number of people that, really want to know when the spraying is going to happen, but it is, the motions have started, and Norfolk County has met and sent out some, now hear this, emails, it's coming, so.
Yeah, it got to admit, it's really early, but that's okay, because it's hard to spray the wetlands when they're all covered with snow and ice.
No, but one thing that they did last year that really was a big benefit is they were able to put the pellets into all of the wet areas.
Okay,
It killed all the larvae the first go round, so we had a very mild mosquito season last year. And I'm feeling that, that's key again.
okay. Yeah, they'll do the larval treatments by hand, right? Yeah.
Well, no, it's pellets dropped either by the,
Just pellets, okay.
so it's still aerial.
Still arrow, okay. Got it.
Okay, bills.
Bills.
All right, I'd like to make a motion to pay WB Mason for a series of office supplies, $263.21.
I'll second that.
All those in favor, say aye.
Aye.
Opposed, motion carries.
I'd like to make a motion to pay a betterment bill to Dave Brown and Marco Mendez at, let's see, 1153 South Main Street for $7,500.
I'll
Okay, all those
second
in
that.
favor-
It says nine,
sorry.
Janet,
All
though.
those in favor say aye.
Aye,
Oh, sorry, let me look.
Opposed, motion carries.
Oh, Dave Brown is South Main, so 9 Janet Street, I apologize.
okay. So I'll second that, and I guess, right. 9 Janet Ave, okay.
All those in favor say aye.
Aye.
Yeah, I already said that, and then
Did I
That's
make
fine.
the revision?
Well, we
Okay.
updated the Janet.
All right. I'd like to make a motion to approve the signing of the betterment bill between the town of Bellingham and is it Rebecca Booth? Bousquet, Bousquet,
Oscar,
at 7 Mohawk Street.
I'll second that.
all those in favor say aye.
Aye.
Opposed, motion carries.
And then I'd like to make a motion to approve the septic plan review as reviewed by our health agent. Let's see, 310 CMR 15.4051B to allow the septic tank to be installed 5 feet from the foundation where 10 feet is required. And then 310 CMR 15.4051B to allow more than 3 feet of cover over the leach field. Waiver to allow up to 5 feet of cover.
Okay, I'll second that.
All those in favor say aye.
Aye.
I apologize.
Motion
That was
carries.
43 Taunton Street. Okay. And I'd like to make a motion to approve the septic plan review for 50 Woodland Road as reviewed by our health agent. Let's see, 310 CMR 15.4051B to allow the septic tank to be installed 5 feet from the foundation where 10 feet is required, and to allow the leaching field to be installed 11 feet from the foundation where 20 feet is required. That's a big
Okay,
difference.
I'll second that.
All those in favor say aye.
Aye.
Motion carries.
That's it.
All right,
Drop
wanna-
this in your mailbox, Tricia, tomorrow morning.
What's that?
I'll drop this in your mailbox tomorrow morning.
Yep, that's fine. I'm working, but I'll grab it and give it to you Thursday when I see you, hopefully. Oh, actually, not you.
Don't go to
I'll
Vinny.
bring it to Vinny.
Okay,
I'll see you Thursday, Vinny.
that's
Yeah,
good.
either like, just give me a shout, I'll grab it, and then I can catch Vinny on my way in or something, just,
Yeah.
whatever,
Okay.
we'll get together somehow.
All right. Sounds good.
Like we satisfied our agenda.
Okay, I'll make a motion to adjourn.
A second.
All those in favor say aye.
Aye.
Opposed, motion carries. Have a great night, everyone.
Okay, you too. Thanks. Bye-bye.